good to get a test run and get all the kinks out, right?
Yeah. Well, what up, brethren? It's Humus with Attitude. I am R.A.O. Laster. Joining me today is Levi Shinkle, and I wanted to talk to you about what you do around here in Wyoming. First of all, you're the in the Democratic Party for Hot Springs County, or the chairman, I believe.
Yes. Chairman of the local party, and I'm chairman of a statewide organization of young Democrats aged 14 to 35.
Well, that's interesting. I like the fact that we're getting younger people into voting and into the political process, so that they're not coming into it blind when they turn 18.
Most definitely. The way we look at it is kids that are 14, 15, they're going to be voting age soon enough, and they're the ones that are going to be saddled with all the problems that my generation before, baby boomers, millennials, that we're leaving behind. So it's better to get these young kids involved now, get them up to date on what's going on so they can make informed decisions about their future.
Right, and that was actually one thing I wanted to talk about today, was the one topic voter policy that a lot of people have, where they have one issue that they care about, and it will make or break their party, their voting, their decisions. And are you doing anything to educate on that fallacy?
So we like to focus. I mean, obviously, things like presidents, senators, those take a lot and mean a lot to people and to our state as a whole. But down ballot races are literally where the changes happen. Our votes for president are, they're not going to make or break a lot of things. The policies are going to affect Wyoming, but not nearly as drastically as policies that are made in Town Hall down on Arapahoe Street. Policies that are made in Cheyenne. Those are the races that are really important, that we need to educate people about, so they know town councils, state legislators, mayors, sheriffs, things like that. Those are what are really important, especially for small communities like Demopolis here.
Right, and I think it's also really important for people to know not who they're voting for, but what they're voting for.
Oh, most definitely. I mean, you want to be an informed voter, right? You don't want to. I'm not a big fan of people that vote one way because that's how their parents do it. I want you to make decisions that are informed upon your own opinions. I've been a Democrat since I've registered, but I grew up in a very Republican household. I mean, they weren't the most strict Republicans following. When I was younger, this hyper partisan that we're in now wasn't nearly as bad. But I struck out on my own for a while. I met different people. I was able to see different viewpoints, and I think that's influenced a lot of the ways that I vote, the way that I look at candidates.
Right. I was actually this is a problem that my cousin was actually having recently regarding the homeowners and insurance corporations, with her basically being locked out of a mortgage from not being able to get insured because her insurance was revoked, because her place was in a kind of a high risk area. And not only did I see a problem where it seems like the insurance companies are placing a bet thinking they're going to lose and then pulling their money out. No, they never even put the money in to begin with. And now they're going to tell people, we're not going to insure you. We're not going to reimburse you the money that you paid us for doing absolutely nothing. And now you stand to lose your home because we won't insure you.
Well, I think anytime you pass laws that exclude certain sets of people, we're doing things wrong.
Right. When a teacher who is paying her mortgage cannot continue to pay her mortgage through no fault of her own, that's a problem with our policies.
Oh, very much so. We need to not be making exclusionary laws. I mean, plain and simple, across the board, if you're passing laws that exclude a certain subset of people,
right,
I think we're failing.
Well, it's not excluding teachers. It's just for this area in California, Wilford Heights.
But it's still excluding citizens of that area. I'm not talking directly to teachers,
right,
or anything like that. But it's excluding people that can't afford to buy houses in more affluent neighborhoods, that are forced to buy homes in neighborhoods that maybe aren't as the word I'm looking for, desirable is deemed by the bank.
Well, it's not that this is an undesirable house. It's just that due to the recent wildfires, they're revoking insurance.
Well, to the insurance company, that's an undesirable location because there are these mitigating factors that make you owning a home there more of a risk for them. And that's the whole issue with insurance is it's all about risk, and that's problems across the board.
But if they're not willing to take that risk anymore, I think at the very least you should be reimbursed the money that you paid in and haven't gotten paid out. Like, for instance, they revoke your insurance after a fire takes place, and then they pay you out and then say, no, we can't insure you anymore because this is a high-risk area. I think that's perfectly fine. But when you just decide an area is high risk and revoke the insurance without any kind of reimbursement or trying to get them with another insurance company, you're basically just locking somebody out of homeownership because it's a risk you thought you wanted to take and didn't.
It's definitely a flawed system.
And insurance companies are getting wild in every place, and we're trying to talk about this healthcare system now. And I think it was Buttigieg who was talking about universal health care for all who want it. And I know Biden was talking about the opt-in program as well, where you can keep your private insurance. But the way I feel about it, as long as private insurance is still out there, it's going to do what it can to cripple the universal health care system, and it'll be the oligarchy putting their money into private insurance while the people who have to depend on universal health insurance are basically getting underpaid, understaffed hospitals.
Well, I think we made steps in the right direction with the Affordable Care Act. It worked well for most who wanted to keep their private insurance if they wanted to, or if you weren't able to get it, you could get it under the healthcare.
The Affordable Care Act.
The marketplace, the health marketplace. I saw my insurance premiums go up definitely under Obamacare with my private insurance, but I also got better insurance. Before Obamacare, the Affordable Care Act, I'm a high-risk insurer. I'm overweight, I have family history of heart disease, things like that. So, all I could afford at the time it was either cheap plans that covers, a heart attack, or an expensive plan where I could visit the doctor. But now with the provisions that were passed under the Affordable Care Act, I have a mid-range plan where I can see a doctor for cheaper. I can get a surgery that I need taken care of, and it's not going to break the bank. I think they can coexist. I don't think they can coexist in the current format that we're in.
Well, healthcare is being, healthcare plans are being crippled by insurance companies right now. And what it's basically doing, people are saying that if we get rid of private insurance and make healthcare free, then we're still going to have this problem with underfunding and understaffing. But one thing I don't think people are recognizing is that I could take care of every health problem I have ever had in my life with less money than one CEO makes in 1 year.
Well, that's where we're talking two different. Yes, health insurance CEOs across the board are probably paid too much here in America. But unfortunately, it's not as black and white, I feel, as some people try to make it. One of the reasons we face the costs that we have here in America are the fact that we lead the world in medical research. You can't have the R&D that we have without paying for it. That's where the costs come in. The pill A costs X amount of dollars, not for that pill. It costs that much for the first 10 that were made, where they had to go through the trials, they had to do everything, get it out so that we could have the best medication, best healthcare practices. And I think that's where we need to be able to reconcile between the capitalist view of it and the 100% Medicare for all kind of thing. It's definitely other developed nations do it, but none of them lead the way like America does.
Well, I know that we're pioneering in R&D, and I understand that you're not paying for just production cost of that pill, you're also paying for the doctors and researchers that had to put years in it before the pill was ever a tangible thing.
Hmm.
But when we see evidence of things like insulin, where the price jumps up 400% in a few years, that's not R&D.
No, definitely not. And that's one of those things where we need to be able to balance the the the, the money that's in it between R&D and the people, because I mean, I believe the original patent holders of insulin, made it available for $1.
Right, exactly.
But then you have people, these greedy healthcare companies that come in and gobble that stuff up, and then charge more under the guise of innovation, when they're not really changing anything. They're just slapping a new label and a new picture on it and calling it new. Whereas outfits that are doing, research into like HIV and AIDS, where they're actually making groundbreaking research, it's hard to reconcile between the two. And I think that's something that we'll need to do in order to move the healthcare industry along.
I definitely think in the pharmaceutical district, we need to find a way to fund the research, but we need to find, like you said, that balance between funding people and enabling an oligarch.
Hmm. And I mean, there's definitely ways. I mean, nothing like that is ever going to be easy. You can either pay for it out of pocket through your insurance premiums, or your taxes can go up.
Right, and I would not. And we're talking about with a lot of people. They're talking about your taxes could go up by $5,000 to $8,000 if we have a universal health care plan. But when a lot of people are paying $8,300 to $8,400, $8,300 minimum on their health care, they're going to be saving money.
Right,
with
you're
universal.
replacing one with the other, and a lot of this always comes down to money, and especially we have such a complicated tax code here. Imagine if we can eliminate these tax loopholes that billionaires use, like places like Amazon that don't pay anything in federal taxes.
Oh, not only did they not pay anything, they got money back.
We fix loopholes like that. That'll help pay for these kind of Medicare for all programs.
Right, as long as people are actually paying their fair share, there's not a shortage in the income. There's not a shortage in the resources that we have. Just as long as we can disperse it to where 50 people don't have 99% of the money.
Mm-hmm. I agree. People, it's something I notice in my professional life as well. I work at the Wyoming Dinosaur Center here in town. And one of the things that people have the hard time grasping is like quantities, like time. The Earth's 4 billion years old. The people have a hard time reconciling how long that is. Same thing for money. People often think that $1 billion is just a few more than $1 million.
Oh no.
But if you think of it in time, a million seconds is like 11 days, whereas 1 billion seconds is 32 years. It's an astronomical change, but people don't seem to understand that. Having $1 billion, if we tax 30% of that, they're still gonna have more money than they know what to do with.
If I got the 30% that they were taxed, I would have more money than I knew what to do with.
We all would. And that's where it comes down to paying your fair share. 30% of $1 billion is a whole lot less than 30% of 1,000. If you got $1 billion, and I take $300 million of that, you still have a lot of money.
Right.
But if you're making $1,000 and I take 300 of that, you're way off worse. You're not nearly as well off as the one that. And that's another thing we have to be able to reconcile here is things like flat taxes aren't going to work because they're not fair.
Right, as long as we had the tax loopholes, then flat taxes are never going to work.
There's no equity in it. You get the equity in charging people that have more money than charging people that don't have the money.
Well, I had managed to not post this, so we're not having anything going on in the live stream today. I'll make sure to get it on, but it was great to talk with you,
Definitely.
Levi, and I hope to have you on again.
For sure.
All right.
Anytime.
Well, you guys have a great day, and I will return.